Good morning, everybody. And thank you very much for joining us. We're back after the break. As Alinda said, I'm Hilary Bauer. I'm the Interim Deputy Director for Research. And our research is, as you can see on this slide, really multidisciplinary. We have, as Ashley said, multi-disciplines in our core deployable team, public health disciplines, and we try to replicate that in the research we do as well. Now, I'm going to take a very quick fire rush through our research program. As Dan mentioned, we have a lot of research going on, but hopefully this will pique your interest and you can always get in touch if you're interested in something. So we do research in many different countries. We tend to do research either where there has been an outbreak specifically or where we think a preparation for an outbreak, for questions for outbreaks. Prone diseases are going to be hot on the agenda, and we work very closely with partners in those countries to try and identify the questions that would be priority. I'm going to just give a quick idea of some of the research. So one of the things, of course, we do is try to identify unknown pathogens in the field. And I'm going to just draw attention to three particular ones here. The small hand with the small box, many of you will recognize, is this wonderful tiny gadget called the nanopore, the MinION nanopore, that can assist with genetic sequencing. And what our microbiology team and our genetic scientists have been doing is testing these methods in the field. It's been used in Vietnam for influenza. It's been used in the Philippines for dengue. It's been used for avian influenza, as I mentioned, in Vietnam. Now, Dan also mentioned that we do a lot of research in Lassa. And the issue of Lassa fever is, of course, very important, but we also found, as Dan said, a lot of Lassa negatives. And what we've noticed is that in many countries that we work in, many countries that I think you will also have experience of, you often find that people are identified with a particular disease, but then when they test, they're negative, but then we don't really know what they are. So we've mentioned the Lassa, but actually we've done the same for dengue in the Philippines and found, in fact, a new strain that was not known to be there, working with people from the Philippines National Public Health Institute to identify those negatives. We also look at pathogens from a point of view of what are the most prevalent pathogens. My colleague, microbiologist Ben Gannon, has been working with the team in Sierra Leone in Conant Hospital to develop a new algorithm to understand how they can target their laboratory resources based on the distribution of the different kinds of pathogens that you find in gastrointestinal disease in Sierra Leone. And the picture with the different colors there is the algorithm they've come up with. There's another way. I mean, sometimes you're in the field and you've got an outbreak and you just don't know what it is. So in this case, we were working with actually quite a long-standing team of colleagues in Sierra Leone where we had been developing a pre-written protocol that we could deploy in the field with pre-trained local teams that we were working together with in case there was an outbreak of something we didn't know the source of in Sudan. And anybody who knows Sudan or anybody who's from Sudan here will know that it is quite a hotbed for outbreaks. And in this case, it was an outbreak in the east of the country in Kassala, which originally actually people thought was chikungunya, but in fact started to see some hemorrhagic symptoms. So we were asked, and we went with our team, as you can see in the picture there, to explore what that, very quickly, what that pathogen was. And in fact, we were able to confirm that it was chikungunya, but that also talked to us about the severity of the disease, which led to a research project looking into that. Now, I want to point out here that that investigation, despite being in the far east of Sudan, in Kassala, involved clinical, epidemiological, molecular tools, genetic sequencing, actually done for the first time, to my knowledge, in Sudan. So, and we were working with the laboratory team, the epidemiology unit in the department. this connection, this collaboration is crucial. We did a similar thing with Crimean Congo hemorrhagic fever, discovering that was a source of an outbreak in Darfur, but no time to go into detail on that. We can provide the paper for you if you like. Along with identifying those pathogens, we work to improve case management. And I'll give you one example here. So we were deployed as a team to the pneumonic plague outbreak in Madagascar to work. It was a go-on deployment, as Ashley described. And we worked alongside clinicians there, my colleague who is a clinician, looking at the characterization of what seemed to be an unusual pneumonic plague outbreak, and then built on that to develop clinical trials to improve the treatment algorithm that was used. And those clinical trials are continuing on that track. We also, as Dan mentioned, are looking at the use of rifampicin in the treatment of Lassa fever in Nigeria with the teams in Owo, in Nigeria, to try and do the same thing, work out if there's a better way of managing cases. Infection prevention control, we're an infectious disease and outbreak team, so, and the people we work with are all working with that. So infection prevention control is crucial. And our colleagues have been working very much with the Africa CDC and the African Union task force, particularly for COVID, but also in the past for Lassa fever, to look at the best PPE policies, the best forms of PPE, and the fact that not all PPE is the same for every disease, not the same for Ebola, not the same for Lassa, not the same for COVID-19. How do you really find the best way to protect your healthcare workers in these situations? We're also just starting some research actually to look at the relationship between healthcare workers and family carers. Again, many of you will know that families really provide an essential support in facilities, but often in an outbreak, they're told to stay away because people are worried about the nosocomial transmission. So in this, what we're trying to do is see how we can better support using different methods to be able to allow that relationship to continue. That's a new piece of research. I'm going to skip over this one, not because data collection in response is not very, very important, but because we have relatively little time. And I think you'll probably be able to see these slides and follow these links, the different tools that we're trying to develop to assist in outbreak response. Lastly, this is our mental health response. This was set up specifically in COVID-19 to look at mental health during the COVID outbreak or the COVID pandemic in Africa. And it's building a consortium of African experts, African interested parties to be able to coordinate and improve the response at each national level. This is work that is underway and we hope will be published shortly. So again, I'm going to skip over this. Katie talked to you a little bit about it. You know, we do get our funding from the Overseas Development Assistance. Research that comes to us, we're not funders. We work together with people to develop that research and then perform that research. And it is assessed and quality controlled, if you like, by a technical steering committee, by DHSC and NIHR. And also then obviously we go through ethics in the country and ethics in the London School. So finally, this is my final slide. I guess this is what we think we are helping to do. And this is what we hope we will help to do in the future in collaboration with our partners as our research develops. Thank you very much for your time and attention, and sorry for the speed. Over.